future brighter. I have the pleasure of introducing these eminent presenters and panelists. Dr. Eugene Genga, who will guide us on nutrition and lupus. We will get life experience from two patients, Ruby Wibo and Belinda Mwema, childhood and adolescence. Dr. Nakichari Saibil as graciously will be presenting sexual health and pregnancy in lupus. When Alex joins us, he will present living with lupus, a male perspective. Felista will talk to us about the female perspective. And Professor Oyo, when he joins us, we'll talk about treatment options for lupus. Mr. Christinani, when he joins us, we'll be talking about work-life lupus balance. Veronica, who has joined us, and thank you for joining us, we'll be talking about lupus and finances. Then we'll have an opportunity for questions, and of course, we'll get a vote and closing remarks from Dr. Simon Okewa, who is a medical officer and a champion for lupus. Mine is now to request Nick to make the presentation or the PowerPoint for the poem for lupus. Thank you very much. We are getting our presentation, and as we go into this, I'll be requesting Dr. Eugene to be ready, and is our next presenter. Dr. Eugene is a renowned dermatologist and a lecturer with the Department of Medicine, University of Nairobi. Is a great rheumatologist trained in Liverpool and many other places. Of course, a great teacher with numerous publications. He takes good care of our patients with lupus. Sorry, because of the delay, we'll put that poem later on. And let me ask then Dr. Eugene to go ahead and share his slides on nutrition and lupus. Dr. Eugene.
Thank you, Dr. Etao, for that kind presentation. I'm humbled to present during this World Lupus Day. I hope my slides are visible. I was given this very interesting topic on lupus and nutrition. I hope I'm visible and audible. Okay, so mine is a very short presentation. When you look at lupus and diet, one would ask, how does diet impact lupus? One, weight changes. Two, the role of inflammation in terms of the science of the disease. Three, osteoporosis, bone health in short. Four, things to do with the heart and pressure from kidney, high blood pressure, and atherosclerosis. So when you look at weight and high blood pressure and kidney disease, there's a vicious cycle involved in the science of the illness. One of the major complaints we see from our patients is decreased energy and mobility. And this usually leads to loss of appetite. Loss of appetite leads to a lot of junking or unhealthy dietary habits. There's also a role of stress and drugs. And this all play a role, especially in the cycle when we're dealing with weight, high blood pressure, and also kidney disease. So in terms of what to do, and that will be the next thing. Maybe first, before to do is to mention that lupus patients have an increased risk for heart attack, partly because of the disease, partly because some of the medicines. I know still some of the medicines we commonly use in lupus, not that they are bad drugs. When used correctly, they are actually safe and good drugs, but when used incorrectly, high doses of a very long time have issues with weight gain, can raise blood sugar, can also raise cholesterol. So what is the recommendation? The recommendation from the American guidelines. Basically, if you want to control the pressure and the weight, you should have a diet low in cholesterol and saturated fats. People who have got high blood pressure or kidney issues, diet low in sodium, basically limit the amount of salt you take. Those on steroids, because steroids have issues with the raising of sugar and cholesterol, we recommendations as a low fat diet and a low cholesterol diet. So preferably avoid the solid fat, more of the liquid fat, which would be the corn oil, the sunflower oil. Those are what is recommended. If you do intend to snack, because I know sometimes you want to snack, what is recommended are more of the vegetables and fruits, because they are low in sugar and calories. So in terms of inflammation, this is one of the things which is normally a big debate in the clinic, because patients, the signs of the illness is that there's a lot of inflammation. So question would be, does that have any role in terms of inflammation? Yes, it has but a very small role, especially in the inflammation. There are some foods that have been found to be able to mitigate or lower inflammation. These are foods that have a lot of omega-3 or fatty acids. This includes things like fish, walnuts, fruits and vegetables, whole grain. What to avoid are the processed foods. That may not be possible. If you cannot avoid, at least limit the sugars. One particular fruit, one particular vegetable that has been found to be directly involved in terms of activating or saying lupus, the alfalfa spot, the particular vegetable. I don't think it's available locally, but it's something which you should be aware of. Garlic also has been found to have a role in especially increasing the inflammation. Remember, some of these drugs, like the processed foods, also increase the cardiovascular, meaning can put you at risk for diabetes, pressure, heart issues, kidney issues. So indirectly also can stimulate the immune system. So one important thing is bone health. Remember, most of our patients are ladies, and as they approach menopause, estrogen goes down, calcium will go down, vitamin D will go down. So we really have to be aware about that. But also, one of the recommendations we really tell our patients is that they should avoid the sun, which is a very good source for vitamin D. So it'd be good you have to find out supplementing. What can you supplement? Foods that increase bone strength is like the milk, cheese, different vegetables, sardines, eggs. The simple things that can be used to increase the bone strength, not only to improve calcium, also improve your vitamin D levels. One interesting debate is also, is there really a lupus diet? I think that's one question which has always been out there. And I wouldn't say there's a lupus diet. Even from the research and evidence, there's no really diet you can say this is specifically a lupus diet. What they just recommend is that you should be able to eat a healthy, balanced diet at the end of the day with fruits and vegetables. Reduce anything that can improve, that can increase the inflammatory content in the body, things that have high fat meats, processed foods, and substitute them more with foods like the fish, nuts, which have more omega-3, which can be able to be used, especially during a time of a flare. When you're on steroids, remember there's the issue of weight gain and high sugars, so must be able to balance it out. But I think at the end of the day is that whatever you take, you must do it in conjunction and in consultation with your doctor and dietitian. Because at the end of the day, because you really have to know what you're taking. And I think there's no really substitute for food, for medicine in terms of the diet. So what would be the most ideal diet for lupus? One, you're looking for one that is inflammation, discuss what is there. 2, bone strength, muscle strength. 3, combating side effects, especially from the steroids. NSAIDs, the NSAIDs are the painkillers that we like using. That is something we need to discuss also. Healthy weight, because a lot of the symptoms of lupus either is weight loss, the poorly controlled, or weight gain, especially we have side effects from the steroids. And the last thing is reducing heart disease. Remember that a lot of our patients who, the most difficult part, actually, you look at the control of lupus in 2 parts. In the beginning, the first part is controlling the illness, so we have a lot of infections and all that. But in the long term, there's some research that came out from the States that showed that actually a lot of patients have a lot of heart issues. So I think the earlier we start these measures to prevent the heart disease, the better for our patients. And exercise, I know they tell you I'm too tired, I cannot walk all along, but the thing is to try and encourage them to walk as much as possible. So another question which usually brings controversy, can I have a drink? That's one thing that is usually interesting. The answer would be no. I think that's the take-home message. Though I know we live in we have to be human, but alcohol has got its issues because combining, if you're on steroids, warfarin, they can be very harmful to the liver, stomach. If you're taking things like methotrexate, it's a no-no because methotrexate and the alcohol interact with the liver. So I think it's just to minimize as much as possible, but if possible, just to avoid. So some of the questions which we asked as doctors, I Google some of these things. One question I normally ask the patients is it safe to eat red meat? There is no scientific evidence that it does that. Unless you have kidney issues or cholesterol issues, red meat is safe. Two, I've seen patients who also have a gluten-free diet because they say that if they have a gluten-free diet, they have less inflammation and everything. But from the evidence, there is none. Research has been done over and over, there's none that actually does that. Three, a vegan diet, is it okay for lupus? Remember, vegan diet, the issue with vegan diet is that you don't have vitamin B12, which is very important protein in terms of blood production, in terms of nerves and everything, because if you have low vitamin B12, you're at risk for nerve issues and low blood. And remember, lupus also has the same risk factors for damaging either lower in blood or the nerve issue. So we try and encourage us to balance that at the end of the day. So the last question, which I normally asked, and it's normally a big debate: can diet alone control lupus? If you look at the science of lupus, we don't really know what exactly is the cause. There are a couple of theories, but what we do know is that the patients are genetically predisposed, so there's something wrong with the genes. They have in that age group, majority are in that age group 15 to 45. And there's a role of estrogen, sometimes infections, viral can trigger, some medications can trigger, smoking, UV light can do that. For some reason, the black people get it worse than the Caucasian. So you see, it's a complex thing that revolves around in terms of the science of the disease. And if you look at the science there is no role there for diet in terms of as a direct causative effect. Number two, also, if you look exactly at what exactly happens during lupus, that your body's defense system, the antibodies, are not able to recognize the normal cells and the germs. It attacks everyone. So you see, in that particular instance, there is no role also for diet. So the conclusion from all this is that one, actually the major conclusion is that there is that diet alone cannot control lupus. At the end of the day, we just have to combine with medicine. I know sometimes we like the easy way out and we're told it's herbal or it's more healthy and everything. A lot of these drugs that have been used for lupus have been used for 30, 50, even up to 8 years. And we know the side effects. If a problem arises, we know how to adjust. So I think we should be very careful, especially what to Google on the internet. I'll use what Professor Yo says, hata waganga, hata wazungu ni waganga saa zingine. I'll use the exact words. Okay. So at the end of the day, I think it's a relationship between the patient and the doctor. And I think gone are the days where the doctor would sit on one side and give you orders and you just say, yes, sir, and then go home. I think at the end of the day, it's more of an informed medical decision, meaning that we share information, raise your concerns, we look at what you value and the preferences. For example, if you are planning a baby, I tell you can't take a drug called cyclophosphamide, methotrexate, or I tell you wait a bit. It should be an informed thing, and we tell you what are the consequences. If you ask about the herbal stuff, I'll give you a story. One of my patients who was herbal stuff, and for about 3 to 4 months, we had crazy time controlling our illness. So I think at the end of the day is that we're not bad people, and we want the best for our patients. And actually, our joy would be if you can come to the clinic one day and be told that patient is doing well, that patient is doing, not that the clinic rooms are full for patients who are well. So I think at the end of the day is that it should be a shared decision making between the patient and the doctor. I think I'm done. Thank you.
Thank you very much, Dr. Eugene. Excellent presentation. We shall hold questions to the very end of all the presentations. So if you have any question for Dr. Eugene, please keep it, or you'll send it on chat, then we will respond to it. Mine now is to request Nelson to put a presentation as Belinda Mwema, who is a student at Strathmore, prepares to speak to us about living with lupus through childhood to adolescence, and in her now studying in Strathmore University. Thank you. So let's listen to this video, which which Nelson is sharing.
This is me, a poem written with all warriors in mind to show what we go through each day. I wake up in the morning, there is pain all over my body, but I still choose to fight again. I don't have a choice. This is me in my pain. Family and friends reject me because they can't handle it, but I cannot run away from it. I have to face it head on. This is me in my loneliness. Doctors try to fix me with medication, but it's way more complicated. I have to keep the whole me standing. This is me trying to fix myself. My hair falls out, I gain weight. I have rashes, I lose my teeth. I'm not what I used to be. I miss the old me. This is me, the new version of me. I face death so many times, but I have to hold on with all that is in me. This is me, because I can't let go. This is me in all my brokenness, but I fight. I am a warrior. I am brave, although I am afraid. I fight a battle, although I have no manual. I work so hard to be normal, although I will never be. I show up every day, although I don't have the strength. I will keep fighting. I will show you the truth. I will not give up. I will be the best version of me. Support me, listen to me, guide me, carry me. But most of all, love me, because this is the real me. Author Susie van der Walt.
So thank you very much, Nelson. Now is the opportunity to invite Belinda. Belinda, please take the floor.
Thank you, Dr. Eto. Good evening, ladies and gentlemen. My name is Belinda Kalungu Mama. I am 21 years old. I am a fourth-year student at Strathmore University, pursuing a degree in Bachelor's of Business Information Technology, BBIT. And I'm going to give you guys my story with lupus. So lupus manifests itself differently in different people. So for me, it started in 2019, around August. I started getting joint pains, and I went to different hospitals and I'd be given antibiotics, and the pains would go away, but they would come back. And around November in 2019, I got really severe joint pains, and I went to Gertrude's Hospital where I was admitted. And the doctors ran a bunch of tests, and finally on January 2020, I was diagnosed with lupus. When I was diagnosed with lupus, it was very difficult for me. I was in denial, and I had to go get second opinion, and the doctor who I went to confirmed that yes, I actually have lupus. So I had now to accept it and to look at ways of how I will live with it. So in 2020, I had a bunch of flare-ups, and I'd call my doctor, and my doctor would give me advice on like what I need to do, heat up my dose, and the flare-ups would subside. But then now I talked to myself, and I was like, I have to like get to know what triggers me, like what makes me get these flare-ups. So like when I assessed myself, I realized that most of the time, like my flare-ups would be linked to my emotional state. And also the time that I got my first flare-up, I was really exposed to the sun. So I was like, oh, okay, let me try change how I live and see how it's going to be. So since that time, since 2020, I started incorporating things into my life that have helped me up to date. So I changed how I used to eat, because I used to consume a lot of junk food. So I started eating cleaner. Not that I don't eat junk food, I just don't eat it as much as I used to. I started working out, and I prioritized my rest. Also, I consistently took my medication and my vitamins, and implementing all these things into my life has really helped me, because since then I have not had flare-ups, and my lupus journey has been smooth, if I do say so myself. I have regular consultations with my doctor after every 2 months, and we run tests to check if my kidneys are okay, if everything in my body is fine, and so far, so good. Thank you.
Thank you very much, Belinda. Several points that I've taken from you as Dr. Nakitare shares her slides and prepares for her talk. That's one, you noted that the flares were related to emotions. So of course, relaxation and all that now plays a role. You have talked about what Dr. Genga was advising us to avoid junk food. And you said you have no junk food that you're taking. You're working out, so exercise, daily exercise is key. You prioritize rest, pacing, resting, very essential. And importantly, you talked about taking your medication consistently and using sunscreen. So thank you very much, Belinda, much appreciated. Belinda is available at the end also, that she's part of our panelists, and we'll ask her any questions that we have. Mine now is to introduce the renowned rheumatologist at the Kenyatta National Hospital, freshly from down south, bringing new experience and expertise to the care of patients with musculoskeletal rheumatic diseases, and especially lupus, Dr. Nakitare, who will speak to us about sexuality, fertility, pregnancy, considerations in lupus. Welcome, Dr.
Thank you, Dr. Tao. I just want to begin by confirming from you that you can hear me clearly and you can see my slides.
Yes, Dr. I can hear you, we can hear you, and we can see your slide. Welcome.
Okay, thank you for this opportunity, and happy World Lupus Day to all of you out there. My objective today is to highlight or to sensitize a few issues. The topic of sexuality, fertility, pregnancy, or reproductive health in general is quite broad. And so the purpose today is just to touch on a few things. Perhaps a few things may be raised and discussed at the end of it, and just to sensitize the people who are here. All right, so the first thing that we already have heard that lupus affects females predominantly, and most of them are affected while they're in their childbearing years, in their reproductive years. But just because it affects predominantly females, it doesn't mean that there are no men who are affected. And so their issues also need to be taken into account in this particular area. So we're just going to look at one or two issues just to touch briefly, and just a little taste of what should you consider about sexuality, fertility, contraception, pregnancy, and a few things surrounding breastfeeding and childcare. So the first thing that I want to say about sexuality is that what we often do not discuss openly, especially perhaps in this side of the country because of cultural, religious, and other reasons, is sexuality. But today we want to open that door and invite all of us as healthcare providers and patients to become more free to discuss the issues that we may be facing behind closed doors so that we can help each other. So number one, the issue that is called sexual dysfunction, if you see here on my slide, that there is a difference between, or a slight difference in description between what occurs in the male and what occurs in the female. And when you're talking about the male, a lot of it surrounds issues around erectile dysfunction, around libido, and for females, a lot of it surrounds the issues of arousal and desire. But for both of them, matters about sexual satisfaction do come about. And so sexual dysfunction is actually quite prevalent, particularly in elderly people, in the general population. From middle age to elderly, it is almost a universal issue But when you look at our younger patients who have lupus, it has been found that they are at least twice as likely to suffer from sexual dysfunction, and the male is more vulnerable than the female. Some of the issues that surround this are body image issues, knowing that lupus can affect the skin, can affect the hair, can affect how you look because of the medication that we give you. And just having a chronic illness can affect how you approach your sexuality. Some of the medications that we give can affect how you respond, particularly corticosteroids, which were mentioned in the first presentation. There are disease-related factors. For example, you may have joint pains and you may not be able to actually perform sexual intercourse as required. You may be having disease, skin disease or skin rash, and you may feel uncomfortable about how to approach these factors. You may have other things that are affecting the actual performance itself. And then there are a lot of mental health factors that surround the body image issues. They're having a chronic illness that may affect these patients. And then on top of that, the things that affect the general population also will be felt by the lupus patients. So aging, which we've said is already a risk factor for dysfunction, lifestyle issues, psychological, cultural, your belief systems, religion, what are you supposed to do, what shouldn't you do? And of course, the state of your relationship with your sexual partner. It could just be an issue of quarreling and all that. And so these are very complex and very heterogeneous issue around this. And so when one is approaching this matter, one needs to look at all the aspects that may be affecting sexuality. What can we do? Here on the right, you make sure you identify and address the mental health issues of both the patient and their partner, those that are related to the disease, those that are related to body image, and make sure that the patient has a support system and an understanding partner. Healthy lifestyle, which is applicable to all people, not just lupus patients, diet, weight, exercise, smoking, blood pressure, cholesterol, all these things can affect your sexuality. And then just to mention very specifically, all female lupus patients should make sure that they get their pap smears, and those who are within the age group should get their HPV vaccination, especially the young girls who are coming up now. For us on the part of the healthcare providers, look at the medications. If you don't necessarily have to have such high doses of corticosteroids, for example, or any other medication, then you can review it and help the patient. And our patients also should not be afraid to look at the safe cosmetic options that are available. Put on your makeup, wear a wig, just dress yourself up and raise your self-image as you go along in life. What about fertility? So, is fertility reduced in lupus? In and of itself, we do not think that patients with lupus have a significantly lower fertility than the general population. However, there are many factors that are going on in these patients that may subsequently indirectly influence fertility. For example, the medications that we use and the issues of sexual dysfunction that we have mentioned, and the other factors that affect fertility in the general population. If you're talking about chronic infections in the reproductive health organs, if you're talking about checking with the males and whether they have a sufficient sperm count, all those things will still apply to our patients. But looking at medications, using medications again like corticosteroids, but also to mention the other drug that we often use like cyclophosphamide, those two may affect fertility. So what can we be doing in the meantime? Fertility, you need to start discussing from the moment that you meet your lupus patients, you need to start discussing reproductive health from the beginning. Even if you're dealing with an adolescent, you need to start exploring and knowing when this person may want to have children so that you can guide them, look at their medications and see how you can assist them. Nowadays, there are a lot of people who are offering assisted reproductive technology, from egg freezing and moving on to other things, IVF, and I don't know where surrogacy is in this country, but we should refer our patients to all these options. What about then pregnancy? When we talk about pregnancy, I'm not sure.
Those things, baby.
Just hold on, I think there's some.
She did what any of those things.
Maybe Dr. Eta, were you able to?
Sorry, let me call Dr. Jean. Dr. Continue, I'll call him.
Okay.
she's really breathless, isn't it?
All right. So let's just try to direct yourself to my voice. Okay. So on issues of pregnancy begins at preconception, before the patient actually even decides that they want to have a baby. So the considerations for us as healthcare providers and as patients is to know, when do we want to have a child and plan for it. And before we talk about having the child, we should access safe contraception in discussion with our healthcare providers. We need to know whether pregnancy is advisable for us at that moment, or even for the life, so that you can start planning in case it is not advisable for you. You need to have good disease activity for at least 6 months. That means your disease needs to be quiet for at least 6 months before you start attempting to conceive. You have better outcomes there in that way. And there's some medications that are not safe in pregnancy and breastfeeding. I will quickly give a table just after this, just to quickly highlight the medications. And then your doctor, or for the healthcare providers who are here, there's some preconception blood tests that need to be done. And in a nutshell, you want to make sure that this patient assess the risk for neonatal lupus, assess risks that are associated with antiphospholipid syndrome. Those two are critical before pregnancy. And of course, you want to check all the other general population factors before pregnancy. Make sure that they do not have anemia. Make sure that they're the right vitamins. Start them on folic acid before they start trying to conceive. So as we've said here, you follow the standard antenatal protocol, work hand in hand with the gynecologist, assess for disease activity during pregnancy. You may have to see this patient almost every month, if not more frequently, depending, and be clear about the medications that can be used. Okay, what about breastfeeding and childcare? What are some of the things that one needs to think about? We've already alluded to the issue of medications and disease activity, but other factors surrounding lupus can affect how well the mother is able to breastfeed and take care of the child. Our patients have more fatigue than the general population. They also experience pain more than the general population. And then they have the usual problems that you've come from the hospital. Maybe you've had a cesarean section, in-laws are in the house. Is your husband there? Is he supporting? Are you able to eat? You're dealing with a scar, maybe you're dealing with other problems that just come with the normal newborn in the house. So let's follow the Ministry of Health guidelines, of course, as far as breastfeeding is concerned, as far as possible, when it is safe and feasible. But for our patients, we want to help them to have support. They should seek and accept help and understand the concept of self-care. In certain cultures, probably in this country, there is a lot of pressure on women to become, I don't know if it is Proverbs 31 or some mythical woman that is mentioned in Bibles and other holy books, and other issues about submissions, and these expectations on women can just make it difficult to perform their roles in breastfeeding and childcare. So our suggestion here is that every patient should look for the best thing that works for them in their house, and probably ignore all other dogmatic suggestions that may just make your life difficult. Yeah, if you need a house help, just get a house help. Okay, so for the medics around, quickly, just to know that on the right there, patients with advanced cardiac and pulmonary problems and stage renal disease should be advised not to conceive. And on this other side, you need to have a lot of care and work with a multidisciplinary team. If these patients are having a flare, their disease is not controlled, if they've had a stroke, pulmonary hypertension, if their lungs are involved, if they have late stage kidney disease, blood pressure, and if they've had previous complicated pregnancies. And just another one again for the medics and also for the patients, because we know that you know your medication, that on this safe to continue includes hydroxychloroquine and sulfasalazine, among other medications. And of course, you want to avoid methotrexate, leflunomide, and mycophenolate as you move along. There are other medications that we can use in pregnancy when it is necessary to preserve the life of the mother. And so that should be understood both by the healthcare provider and the patient, that there are some drugs that you might read are not safe, but we might decide that you need them because the benefits outweigh the risk during these times of pregnancy and breastfeeding. And so what have we said today? And of course, at the end of this, those who have questions can ask and we can discuss them in the panel. We want to say that reproductive health matters should begin to take more of a priority with our lupus patients, and indeed for all our rheumatic disease patients. We should address them as part of routine care, find out the parity of your patient, see what their plans are and advise them. And we should open an environment, have an environment that allows free discussion of all these matters which are considered taboo. We should just allow our patients to speak and discuss. And we should early in the day refer the patients who need better care, more specialized care, and other assistance. So thank you, Dr. Tao, and thank you to everyone for listening.
Thank you very much, Dr. Excellent presentation. As Alex Nagicho is preparing himself to come on, I'd like to recognize several things that you mentioned, that of course sexuality and sexual health is important for our patients, that pregnancy of course is possible, because many patients are told out there that they should not, that it's not possible to get pregnant with lupus. And thanks, Dr. for reiterating and reminding all of us that yes, the pregnancy is possible, and only in certain conditions where, of course, it's a shared decision between the patient and the doctor and the attending doctor. And importantly, to also prepare for this pregnancy. And matters of sexual health should be discussed. I liked what you said. You said we need to talk about what we need to talk about. We need to talk about sexual health and about sex with the doctors in the practice. Thank you very much, Dr. Mine is to now introduce Alex Nagicho, who is a banker and a warrior, who is going to talk to us about living with lupus, a male perspective. Welcome, Alex.
Thank you, Dr. Thank you for this opportunity, and happy World Lupus Day, everyone. Now, mine is not going to be such a long session, but I'll share with everyone about living with lupus as a man. Well, there's a study that is done among 10 patients who suffer from lupus. One is a male. So on the male side, we are not so many. Particularly myself, I only knew, I think, about 2 warriors. But it's sad that one left us. And now I only know of one other warrior who is a man. On our end, it's not an easy journey. It is quite similar to what the ladies go through. However, what maybe I can share is that sometimes our flares are way more difficult to handle as compared to our counterparts. Maybe the doctors will speak on that maybe later. So my journey started back in 2016, but I got to get a diagnosis in 2018 August. So when it started, I just had Raynaud's, which my fingers and toes kept going cold. So I never realized the color change and thought maybe it's just the climate that is maybe affecting me. So that was back in 2016. In 2017, I started experiencing more flares with the Raynaud's. Now you see, anytime I used to have these flares, it was during the cold months, between April and say August. So I never thought it could be a medical condition. Now in 2017, my knees started acting up. So I went to the first clinic, they did some tests, did blood work, nothing came up. So they simply gave me painkillers and told me, anytime you feel this, just have a painkiller and all will be well. So that was the reason for a few months before my feet now decided to swell. I had oedema. So I visited Mata in Buruburu. That is when one of the nurses there referred me to the main hospital and booked an appointment with Dr. Oyo. So upon visiting Dr. Oyo, he told me you could be having a rheumatoid arthritis, but we'll need to run some tests for us to get a confirmation. Now, interestingly, at this particular time, I didn't have a job. and the tests were quite expensive. I remember the cost was coming to a tune of about 50,000. So I tried to changa money here and there. I did a few tests. I couldn't do all, but at least I got some medication that was helping relieve the knee pain. Now, I can't say it was ignorance or maybe lack of finances. You get to a point, you stop seeing a doctor. So my symptoms, I think, went into remission. I disappeared. I stopped seeing Dr. Oyo. So fast forward, in 2018, I got a job now where I am currently. And just before my insurance was activated, I got a really bad flare, which led me to get hospitalization. Now, prior to this hospitalization, I kept having blackouts. I would maybe just wake up in the morning. As I leave bed, I black out. So I thought maybe I was pushing myself too much, not considering that maybe it could have been something underlying. So when I think I got the second blackout, my fiance, who's my wife now, was like, "Hey, Apana, we need to go and see a doctor." So we went to a clinic in Upper Hill. Back then, that was a doctor who deals with the kidneys, a nephrologist. So he got to see us, gave us a couple of tests to go and run. We went, did the tests. Nothing still came up. But on the tests, they noted it's like I didn't have enough blood. Blood was just disappearing. So they had to do an admission, and I got a blood transfusion. So after that, they still put me on just painkillers. I didn't get much because nothing was coming up from the tests. That was until when someone had mentioned that you could be having something to do with an autoimmune disease. To be honest, it was the first time I heard about an autoimmune disease. And just by the name, I was actually scared. I thought, now my life is done. I probably have 1 or 2 years to live, and that's it. Because some people had even gone ahead to say this could be a case of leukemia from the blood issue. So we got the first admission at Nairobi West. We did a couple of tests, still nothing came up. But all this time, the symptoms would come and they'd go. So about a month later, my hair decided to thin. It's like I lost almost all my hair, and I had to almost clean shave my head to hide the patches of hair loss. So we then had gotten someone had just recommended we go and visit a rheumatologist. So we went and saw a rheumatologist. That was in August 2018, where I got a second admission. This was actually in a span of 2 months. So I got the second admission. We ran a couple of tests, but all this time, it's like my body was now bringing out all the symptoms related to lupus. Only that we hadn't confirmed that it was lupus. So I was experiencing a lot of fatigue. I was having hair loss. I had the rash, the butterfly rash on my cheeks, but we just had to do the tests before we could jump into any conclusion. So we did the tests, and the diagnosis came. I had lupus. So now after lupus comes now the trouble with managing lupus. There is a bit where, as a man in the African context, a lot is actually expected from you. But you now get to a point that you have to accept you'll not be able to do everything on your own. You need help, you need people around you, you need to delegate duties. It's actually something difficult for you to learn, especially when you're used to doing all things by yourself. So fast forward to 2020, I can say it has been a roller coaster because a couple of opportunistic illnesses have also come along the way. So there's lupus, vasculitis came along the way, diabetes. It's quite a hassle, but all I can say with the medication and keeping your diet okay, at least you're able to control the disease. And whenever a flare is going to come, you as a patient are actually able to tell something is happening. Because before any major flare up, I'm always able to tell, hey, my body is acting up. I can tell the fatigue sessions are getting a bit more complex. I'm not thinking straight. I'm starting to forget things so easily. I can't concentrate that much. So it's quite a bit to deal with, to be honest, but we take each day at a time. Thank you, Doc.
Thank you very much, Alex. Thank you for sharing. There are many things he has not mentioned. Some of them I would like just to mention. I hope it doesn't come and box me later. That even in the course of this illness, he's been able to maintain his job. He actually got a job. He's gotten married, and he has a lovely wife. And he has a lovely child who is a father too, and he's bringing her up. So thank you very much. Any questions for him, we'll ask him at the very end. Now his mind is a great opportunity to invite all the way from the, I don't know whether Mombasa is down south, Felista Sauti, a warrior, who's going to give us some female perspective of living with lupus. Welcome, Felista. Felista, welcome. Are you on? Felista is muted. Felista, are you on?
Yes, I'm on.
Karibu, Felista.
Asante, mi naitwa Felista Sauti, natoka Mombasa na ni mama ya mtoto mmoja, miaka 7, msichana. Na nitaongelea safari yangu ya lupus kama mama. I hope you're okay nikiongea Kiswahili. Mko sawa?
Language ya Kenya ni Kiswahili alafu
Haya, ni sawa. Ni sawa.
But maybe they are good with Swahili.
Haya, ni sawa. Acha tuendelee. Sasa mimi nilianza kutatizika 2015 nikiwa mjamzito wa mtoto wangu. Lakini sikujua kwa sababu nilikuwa nikigonjeka baada ya wiki 2 na nikadhania ni sababu ya ile ujauzito. Sasa baada ya kujifungua 2017 nikaanza tena nagonjeka, baada ya wiki 2 naenda hospitali. Nikifika hospitali wananiambia niko na bacterial infection. Nikimaliza dosage antibiotics after 2 weeks niko hospitali. So hiyo ndio ilikuwa mtindo mpaka 2020. Sasa ikaanza kuwa ngumu, manake nilianza kushikwa na kama tonsils. Sasa nilipopatwa na tonsils, mimi nikafikiria hizi ni tonsils za kawaida, singeweza kumeza chochote. Nikaenda hospitali wakanitibu hizo. After hapo tukaingia 2021. Sasa ndio nikaanza kupata maumivu ya mwili mzima. Ningeamka mikono haiwezi fanya chochote, miguu siwezi kutembea, yani ilikuwa maumivu mwili wote. Ndio sasa nikaanza kuhangaika hospitali. Nikatembea karibu hospitali 7. Baada ya hapo nakumbuka huo muda wote vivi kama mama nashindwa asubuhi kutayarisha mtoto wangu aende shule. Ilikuwa inanibidi na meza painkillers na mtayarisha anaenda shule. Akishaenda shule the whole day nitahangaika kuingia hospitali hii na kutoka. So nikahangaika the whole of 2021 mpaka February February ndio nikapata rafiki akaniambia, hii unakaa uko na ugonjwa ambayo hujajua ni gani. Kwa hivyo I would advise uone physician, acha kuona madaktari wa kawaida. So hapo nikatembelea Nagicho Hospital, nikapata one physician anaitwa Dr. Maru. So Dr. Maru nilipomwona wakati sikuwa naweza wheelchair. Huko hapo nikamwona. Yes. Hello?
Kidogo, endelea tafadhali.
Sasa baada ya hapo kuona physician ndio sasa akaniambia niko na shida, lakini hawezi kuthibitisha ni gani mpaka tufanye some tests. Lakini akanitajia kuwa kuna kitu kama lupus, kwa sababu by then nilikuwa na macho inaniwasha sana upande wa juu, macho yote mawili. Akaniambia kwa sababu vile unajikuna haya macho nashuku uko na lupus. Nikamwambia lupus ndio nini? Akaniambia utaelewa unless we do some tests. Ukishazimaliza ndio utajua. So nikaenda, the test ni pesa mingi. Zilikuwa nyingi na pesa mingi. Lakini nikang'ang'ana nikazifanya zote. Sasa kuna test moja nilikuwa nasubiri.
They are requesting you use English if possible.
Okay.
Ugandans and others.
Okay. So after that was on February. So in February, I did all the tests. And before I completed all the tests, I was actually, my symptoms worsened and I was admitted. That was in February. So on admission, the doctor told me that I had some blood clots. So I was put on medication. And there was another test, I think it was called ENA profile, which took almost a week. And when the results came out, now the physician, Dr. Maru, confirmed to me that I had lupus. So I started the treatment. But as a mother, I can tell you it's not easy, because at times my daughter will just go to school. I will prepare her to school. And I was forced to take some painkillers for me to prepare her to school. She goes to school. When she comes back from school, I'm not in the house. I'm already in hospital and admitted. So it's one of the worst experiences. So I was admitted thrice in March, in February, my first admission, in March and in July. So after the doctor explained to me, and it actually took me a whole year for me to understand what lupus is and how I can manage it. So at least now, the flare-ups are there. Some days are just good, some days are bad. But I thank God as we speak, I can say I at least I can manage lupus. But as a mother, it's one of the worst experiences and one of the worst conditions one would ever wish. Thank you.
Thank you very much. My apologies to those who are not able to understand Kiswahili, but Felisa has been gracious enough. She has shared experience, perspective, her journey as a warrior, lupus, and motherhood, and the challenges that she has faced. So the difference, of course, is she's a mother, and Alex is a father, and they have different challenges. Incidentally, the flares of lupus are actually commoner in males, and you mentioned the other male warrior who was deceased, and the outcomes are actually worse in the males and females. But thank you very much, Alex. Thank you, Felisa, for sharing. We will now invite the father of rheumatology, Professor George Omondi-Oyo, who does not require introduction in this forum, but he's a pioneer rheumatologist and excellent researcher, teacher, clinician. He's going to talk to us about treatment options for lupus. After that, we'll go back to Ruby Miyake, who will talk to us about childhood and lupus. But welcome, Prof.
Thank you, Paul, for that warm introduction. And I'm always happy to talk to patients and others on various issues in rheumatology. Today I was given a very simple task of just mentioning treatment options in SLE. So I hope you are seeing my slides and that you're hearing what you're hearing.
Yes, Prof. Yes, your slides are very clear and your voice is very eloquent and clear. Thank you.
So what is the goals of treatment in lupus? Number one is to ensure long-term survival and improve quality of life. You know, lupus in the past, the mortality, 5-year survival was very low and approaching 50%. But this one has improved with newer treatments and judicious use of available medications. The second goal is to achieve lowest possible disease activity. You want the patients to be in remission and to feel good as soon as possible and for as long as possible. The third thing is to prevent organ damage. In the past, the leading cause of mortality in lupus was kidney disease, and with the improvement of treatment and improvement of management of kidney disease, we are now able to minimize kidney diseases, but it's still a big problem. And the fourth thing is minimize drug toxicity. And one of the reasons why you need to keep your appointment regularly is not only for the disease to be monitored, to be checked how you are doing, but also to check if the drug you are taking is causing you problems. And basically, it is an individual care based on patient preferences, disease activity, severity, and underlying comorbidities and complications. And there's no ready-made medication. Drugs are tailor-made based on each patient. A drug which works for somebody, for one patient, may not work for the next patient. A drug which helps one patient may not help the next patient. So you need to be, although you have your preferences, but is individualized care of each person. Each patient is different from the other. So what are the non-pharmacologic therapies? Some of them have already been mentioned by Eugene and Sybil, and one of them is sun protection. You need to avoid undue exposure to ultraviolet light, and one of the is mandatory. You need to have sunscreen lotions of a certain specification, and avoid drugs that can make you to be photosensitive. Exercise has been mentioned, and exercise, if there's any medicine that needs to be discovered and be put in a capsule and be given to the world, is exercise. And because exercise will prevent so many things other than making you feel good, will increase your bone and muscle tone, and also reduce your blood pressure, improve your management of blood sugar, and also just give you a good weight and make you just feel good. There are several immunization is a big topic now, but any patient with lupus should have pneumococcal vaccine, hepatitis B vaccine, influenza vaccine. Avoid live vaccine if already on immunosuppressants, but you need to be you need to have vaccination. Vaccination is key, and all patients should be vaccinated. Smoking, Eugene alluded to this, and if you're a smoker, you need to stop smoking because it is associated with flare-ups and increased cardiovascular risk. The main drugs, the cornerstone of treatment is hydroxychloroquine, which should be used in all patients with SLE. It is important in relief of symptoms and reduce flares, and is helpful in prevention of thrombotic events and organ damage. The dose is usually 1 or 2 tablets. Although it is widely available now, 10 years ago, hydroxychloroquine was not even available in this country. The second one is glucocorticoids, usually combined with hydroxychloroquine for moderate disease, and also combined with immunosuppressive therapy. It's also used as an immunosuppressive therapy in severe and life-threatening diseases, and the dose varies depending on the condition. The problem with corticosteroids is that it makes you feel good, and sometimes patients do not want to stop it, and side effects are known and can be very severe. Non-steroidal anti-inflammatory drug also is used for mild symptoms for relief of pain, and used as required and as tolerated. Cyclophosphamide has been mentioned when you're talking about pregnancy, but this is a gold standard in the treatment of severe lupus, life-threatening lupus. When you see we unleash cyclophosphamide, it means that it is not business as usual, and that we, especially when you have kidney disease or central nervous system disease, or even lung diseases, we want to give you what the strongest weapon that is available. It also has side effects. It can be associated with passing blood in urine, causing cancer, and is used with caution in patients with chronic kidney disease. Mycophenolate mofetil was initially brought to help patients who have had kidney transplant to prevent rejection, but it has been found to be equipotent with cyclophosphamide in management of kidney disease. And sometimes we use it in maintenance therapy for lupus nephritis and even lupus itself. And the indications are still broadening, and we are using it in many situations. The issue with mycophenolate mofetil is that it is relatively very expensive and not affordable by many patients. But cyclophosphamide has been there for a long time and is cheap, but has got some known side effects. Azathioprine, we use it for induction and maintenance lupus nephritis, and also for management of lupus. Similarly, we use tacrolimus for lupus nephritis, and sometimes when patients cannot tolerate many of these drugs, we can use it also for treatment of lupus. These drugs are graded depending on what you have. The new agents is rituximab is one of those drugs. When you see rituximab being used, it means that maneno ni mbaya kabisa. Things are very bad. The back is against the wall. When a cyclophosphamide is not working or cannot be tolerated, you cannot tolerate the other drugs that we use, then we go for rituximab. The only other drug that came recently after a very long time in management of lupus is belimumab, and this one is used in active disease for active disease, and it's very useful. We have a few patients in this country that are using it, but we use it for active disease that which is you don't just give it, you give it when patient is not responding to other medications and the disease remains active, but also the cost is high, and very few patients can afford it, and even very few insurance companies would wish to pay it for you if you are insured by them. There were newer agents which are there, which I just mentioned. Of course, you read about them in the internet, in Google and so forth. So it's good to know about them. Anifrolumab is a type 1 interferon. This is one of the drugs which recently approved for moderate severe lupus without severe active lupus nephritis or neuropsychiatric illness. So we use it for severe lupus, which was approved for that. And we are watching to see how it's gonna perform in the market. But it is there, you'll read about it, it's being used, and if it was not for COVID, we would be hearing more about it. But I hope one day it will come here when the cost has gone down. Other drugs are obinutuzumab, baricitinib. Baricitinib was meant for rheumatoid arthritis, but and also been used recently for COVID. And there's a study that is going on, and they're going to tell us how its usefulness in patients with the lupus. You can see that lupus was thoroughly invaded. Rheumatology was thoroughly invaded with the COVID era, because this first of all started with hydroxychloroquine, and that led to the increased cost. Then they went to tocilizumab, the one used for rheumatoid arthritis. Now they went to baricitinib, so the treatment of rheumatology medications help a lot in the management of COVID. Daratumumab, there's a study going on, and recently completed. I think we will see. Well, these are things still in the kitchen, and when they come out, we hope that they will help. They will help us in the management of lupus. But the drugs that we have here in this country, we have hydroxychloroquine, we have glucocorticoids, we have NSAIDs, we have tricridomats, we have azathioprine, we have mycophenolate, and we have rituximab. Belimumab can be available on order. So all that we need for management of lupus we have, and there's no limitation in management of lupus, and it's just to balance them and see how best to use them. Thank you very much. I hope I've covered the subject as was expected. Thank you very much.
So thank you very much, Prof. In fact, you have covered the subject beyond the expectation. We appreciate because we are happy you have gone through the drugs available. And as usual, we have hope because there is more drugs on trial, and they are on trial for lupus itself. So thank you very much. Of course, we said questions will be at the very end, where all the presenters will be part of the panel and you'll ask them questions. Now, mine is a great honor to introduce to the floor one of our youngest warrior, who's going to talk to us about lupus and lupus in young age. I will not say childhood. She's Ruby Muyaki-Bwibo, introduced to us by Dr. Lawrence Owino, the pediatric rheumatologist. She's a Form 2 student in Loreto Valley Road. She's our young warrior, and please welcome to the floor, Ruby.
Hi. So,
Hi, Ruby. Hi.
Yes, how are you, Ruby? This is Dr. Lawrence. Proceed.
So I think I'll talk about how fast I got, like the whole journey of how it started and how it's affected me as a young person. So it began in late 2020, like November, December. I started getting really sick, like a lot of illnesses following each other. I started with tonsillitis, and then I got anemia and malaria, and like I was just losing weight rapidly. So I went to hospital in December, and when they were testing me, they saw traces of blood in my urine when they were testing. So they said that I needed to take me to the hospital. But since that time when up country, I went to the hospital in January when I came back to Nairobi. And I was hospitalized for 12 days. And first they said I had nephrotic syndrome. But after a few weeks is when they told me now that I had lupus. First I didn't know what it was, but then now I explained to about everything, yeah, and I was given like a lot of medication, which was like a huge transition from not taking any medicine at all. So basically the most challenges I faced is the side effects of the medicine, especially because like mostly the image ones, like that affect my face and stuff like that. And explaining it to my friends, if they ask me why don't you swollen or they have rashes, or why I have to always put sunscreen, but stuff like that affect me. And it's like hard to explain to them about how it goes. But like I have a lot of progress about it, so it's easy. It's becoming easier to deal with it. Yeah.
Yes, Ruby, please continue.
Not all I have to say for now, unless anyone has a question.
Oh, okay. Okay, thank you very much, Ruby. Thank you first for the courage and to come and talk to us. This is much appreciated. And she's highlighted a unique challenge that the younger persons with lupus are having, of course, or any other person living with a persistent illness who are young. Their peers, the challenge to explain the unique aspects of the disease, of course, and the effect of the disease on their growth, their development, their appearance. And we appreciate that your courage to present to us and the courage to continue taking a medication and dealing with this illness. I'll give Dr. Owino maybe 3 minutes just to talk about lupus in younger persons, if you have any comments to mention now. Dr. Lawrence Owino, our pediatric rheumatologist.
Thank you very much, Paul, and very grateful for the opportunity to talk about lupus in young people and in children. And thank you, Ruby and Belinda, for talking out so that people can know that lupus is not just a disease of adults, but also that young people and children also do get the disease. Thank you very much. So I just wanted to say that, of course, people say lupus is more common in women than in men, and it's a fact. However, when you talk about children, we almost have an equal ratio. So both boys and girls almost get affected equally. But about children is that they usually present with various more severe disease. For example, they would have more of kidney failure by the time they are coming. For adults, many times they get to the kidney failure later as they proceed, depending on how they are being managed. But many children will arrive to us already, they have kidney disease. Many children might arrive with the brain disease. For example, they are having convulsions or epilepsy, and even a disease in their lungs, in their breathing system. So they may have a lot of all these complications. And that means that for children, many times we are very aggressive, the treatment. So we give them a lot of medication that sometimes we don't give in the adults. For example, we give them very high doses of steroids, and that is what Ruby was talking about. These steroids can make your body swell and sort of disfigured, gain weight, and you just look totally unlike what you used to be before you start this medication. We start them on many of them on cyclophosphamide because of the severe disease. This is the medicine that we said may have some side effects, but it's much cheaper, of course, than the other options. And this cyclophosphamide may have some residual effect later in their lives. For example, it is said it might reduce fertility, or rather the number of children, or the ease with which you can make babies in future. And then there comes issues around how to transition to adult care. And when this opportunity came, I was just talking to Paul Letau that now this is a good chance for us to talk to some of our adolescents, including Belinda, on how do we transition. Because many times these children also, and many other people with chronic disease, you become quite attached to your doctor. And you grow now from a child into a young adult, and you just need to transition to care. And that is often a challenge for many people. So I just wanted to mention one more thing about diet. And we have children as young as, I think, 4 or 5 years. Usually it's very rare below 5 years. We have young children who get this, and these children are growing. So many times we also don't want to limit diet so much, because we also know many people in our population, the access to food is a big problem. And if you start saying, don't eat this, don't eat this, it becomes a challenge. So for children, we would really say that balanced diet, healthy diet, as we said, without giving a list that you cannot eat this one or you cannot eat this one. And then there is the issue of pregnancy. For those who become pregnant, then we, the pediatricians, or the children specialists, we need to assess those babies for something that we call neonatal lupus, or heart block, where the heart may not be beating at the correct rate in some children who are born to women who have lupus. So it is very important for the lupus warriors, if you become pregnant, you have a pediatrician or a child specialist that knows something about lupus in newborn babies. Lastly, I've already talked about the issue of using more aggressive therapy or treatment in children, and also because of more aggressive organ damage. And just to say, we have more than 20 children that we are following up. So there are many, many children who have this lupus. Many of them are not diagnosed, but they are there. And I think this kind of forum that we have today is very important to make people aware so that these children can be found and put on treatment for them to keep the courage and make their future bright, because I think that then is actually even more relevant for the children and those who work with the children. Thank you very much once more for the opportunity, and sorry I've taken longer than Paul gave me. Thank you.
Thank you very much, Dr. Awino. Thank you for that synopsis and on lupus in the younger people. Mine now is to invite Mr. Chris Senano. If he's on, please take the mic. He's going to talk to us about work-life lupus balance. We'll have two presenters in the interest, of course, appreciating that lupus affects men and also affects women. So we have two presenters on work-life lupus balance, Chris Senano and Angela KNH. Chris, are you on? Okay. As we look for Chris, Angela KNH, please proceed and be on the floor.
Thanks, Doc. Can everyone hear me?
Yes, we can hear you.
Okay, fantastic. Okay, so my name is Angela KNH, and Doc has just requested me to, just give a brief around living with lupus and how I'm able to strike or how to find some semblance of a balance between work life, living with lupus, and then just your general life. So maybe I'll just start by saying that, from experience, I'm a lupus patient, and I'm also currently employed and in a very high pressured job, right? So what I'd say is that lupus doesn't, it doesn't mean that you can't, progress with your career aspirations. I think we have very many stories around people across the world, and even just right at home, where people are actually thriving, both at, while living with lupus, but also thriving in their career, and also being able to progress within their career. So I'd say, one is just a mental conviction in terms of just trying to achieve your dreams and your aspirations. I think that's very important. And knowing that you can actually achieve all this even in spite of living with a chronic illness, in this case, specifically lupus. I'd say that what has worked for me is that I have a very understanding employer. So I got diagnosed with lupus while I was in employment with this particular employer, and I've been with them since then. So I got diagnosed with lupus in the year 2018. And I'm still working for the employer. Within that period of time, I've been able to progress within the institution. So I'd say work with the employer. So the first thing I did when I got diagnosed is that I actually disclosed my diagnosis to my employer, and specifically my line manager. And together with HR, the organization has been good to me. I know, even as I interact with a lot of lupus patients, we've had very varying stories around acceptance by your employer of lupus as an illness and the support that they offer. So I just say my own employer has been very supportive, I've been, ever since the pandemic and with increased risk of infection, I've been working from home, but now I'm transitioning back into the workplace. So in terms of, some of the things that have also assisted me is prioritization of rest amidst continuous fatigue. So I've been able to really work on my schedule such that I prioritize my rest, especially as one of my greatest triggers for flare is always stress. So given that I'm in a very high pressure environment, I actually prioritize rest and time out. And what I do is that in my time out, I try to do the things that I find are things that touch my heart and things I'm passionate about. So one of those things is exercise, which I picked up about 2 years ago. And, while I can, I'm able to do as much exercise as possible. So at least I ensure that every day I have a 1 hour training regime, just to get me, kick-started. So I'd say rest. I also take and prioritize my leave. So I arrange my leave in a way that at least every quarter I'm able to take some leave and some time off. And then just being kind to myself. So when I find that I'm feeling significantly overwhelmed, I actually deliberately take a break. I always say that, work can wait until tomorrow. So I can do my best today, but if I'm unable to do that, then I wait for the next day and I continue from where I left off. Yeah, and most importantly is just, follow your dreams, work with what you have, and create, a dream and a future when it comes to career alongside what you can do. And once you do that, then you'll find that you're able to still work amidst, dealing with a chronic illness for that matter. And Doc, with the time, I think that's all I'll have.
Thank you very much, Angela, for that perspective of lupus. When she says a highly stressful job, for sure, with her permission, I hope she accepts. She actually leads a very serious sort of team, and she's able to cope with that sort of work in the midst of living with lupus. And of course, she's a great warrior in that regard. And she has mentioned rest, prioritizing, loving yourself as part of the things that one may do in order to continue with the medication and to continue excelling in life as life requires of one. Now, for the male perspective, I hope Chris Senanu is here with us. Chris, you can hear me? If you are, then you can unmute yourself and join the conversation. Or if Chris is having challenges, then mine again, it's still on finances, is to invite Veronica Okello, one of our warriors, then now to take the floor and talk to us about lupus and finances. I'm sure challenging topic, but just to still show that one is a warrior and one has to deal with life challenges, and one of them, of course, is finances. Veronica, you're on.
Okay, thank you,
Sorry,
Dr. Itao.
Can you hear me?
Oh, Veronica, will you allow Chris to join? Yes, Chris, please join, then Veronica will join after you.
Okay.
Oh, okay. Thank you very much. Good evening, fellow Lupis. I hope you can hear me properly. Sorry, I've been unable to join via Zoom so you can see my face, but I'm very happy and honored to be here today. Dr. Itao had asked me to share my experiences specifically on managing lupus in a high-pressure job. And I must say the lady who spoke before me has covered most of it, but I'd just like to say probably three things or emphasize on them. One, actually, lupus has made me much more intentional about how I spend my time and energy. I'm sure most of you know the feeling when you wake up and you have no energy to do anything. And so I've been very intentional. The first thing I did after the diagnosis was, as somebody who's a business person and also a corporate executive, I put together a strategy. And that strategy had 5 pillars. The first pillar of it was stress management. The second pillar was diet. The third pillar was exercise. The fourth pillar was medication. And the fifth pillar was spiritualism. And so all through the last 11 years, that's what I've used to ensure that I keep sane, if I can put it that way. I have also, if you ask my wife, she will tell you I've gotten busier since I got diagnosed. I think it's one of my own coping mechanisms to keep myself busy because I don't even have to think about it. But the truth of the matter is I keep a very strict diet, and I do my best to keep myself away from stressful situations, because for me, what triggered the lupus to start in the first place was heavy stress levels. So I've done pretty well on diet, stress management, and spiritualism. Medication, I normally fight with Dr. Itao. I'm probably his worst client because I question everything and anything all the time. But we cope. The way I struggle is exercise, because I was never really an exercise person or a sporty person before, and more importantly, of course, you know how it feels. You feel tired even before you start to attempt to get onto a treadmill or to walk. So exercise I don't do too well, but the rest I try my very best to keep consistent. And I live an active life. I'm fully engaged. I'm currently the Chief Enterprise Business Officer for Safaricom. I run the B2B section. Over and above that, I sit on many boards. I'm the chair of USIU, the board, and I chair many other institutions and organizations, both here and outside. So if I'm to advise anybody about lupus management, a lot of it comes from your frame of mind. A lot of it comes from having a purpose. One of the other things I did, which is not on my strategy, but it's in my heart, when I got diagnosed, I said, well, I want to be present, standing and walking upright when my daughter gets married. And my daughter is currently 14, and she's as stubborn as her father, and so I don't expect her to get married until she's 40. So mentally, I've tuned myself to the fact that I need to stay not only alive, but healthy and standing upright well for another 20 plus years. And so that also keeps me going. So finding a big, hairy, audacious goal, finding a purpose why you need to keep yourself alive helps make swallowing all those medications, and when you have to check your diet, when you have to ask yourself, why do I have to do all of this? By having that big, hairy, audacious goal, I've been able to keep myself sane. So I hope this sharing has been useful to a couple of you. And yeah, I've always told Dr. Itao I'm always ready, willing to talk to anybody who wants to chat with me one-on-one. And he's authorized to share my number. Thank you for this opportunity to share. And I'm really sorry I was not on Zoom for you to see me physically. Back to you, Dr. Itao.
Thank you very much, Chris. Thank you. Allow me to share the 5 pillars of Chris: stress management, diet, spiritualism, exercise, at least half an hour, even if it's just brisk walking every day, and medication. And thank you very much for taking your time and speaking to us. I know we have exceeded the time by 5 minutes. Please indulge us, give us another maybe 10, 15 minutes. and allow Veronica to come and speak to us, especially after these people from the financial world, on lupus and financials. Veronica, thank you very much, and thank you for giving Chris the time to speak before you. Thank you.
Thank you, Dr. Itao. Confirm that you can hear me.
Loud and clear, Roger, loud and clear.
Okay, good evening, everyone, and happy World Lupus Day. My name is Veronica Okello, a warrior diagnosed with SLE in the year 2012. I was requested to speak about lupus and finances in this session. So dealing with a chronic disorder that requires making frequent doctor's visits, taking medication, and getting regular studies such as lab tests, X-rays done can be an expensive hardship for many. Though there is no data or statistics in Kenya that has been published on the average cost of a person who has lupus, my estimation based on my own utilization of my insurance cover for the period that I have been on active management of both lupus and a heart condition, my utilization was averaging about 1.1 million Kenya shillings per year. Yet these numbers do not really tell the whole story. This is only the direct cost of medical treatment itself to pay for doctors, nurses, lab tests, X-rays, echo, medical equipment, and hospital costs. The other part of the equation is the indirect costs of dealing with lupus. This may include loss of income from time missed from work when having to deal with these medical issues. Although some people who have lupus are fortunate to have excellent jobs with good sick day benefits, as well as excellent health benefits requiring relatively low out-of-pocket payments, others are not as fortunate. Some have to pay high co-sharing payments to see doctors, to get necessary tests done, and to pay for their medicines. Others are even much less fortunate and have no benefits at all, having to pay everything out of pocket or having to rely 100% on government aid. Well, I wonder whether we have that in Kenya. Anyway, an example would be whatever portion that NHIF, for instance, can cater for here in Kenya, such as maybe part payment for bed occupancy during hospital admissions. It is impossible to separate the financial problems of lupus from dealing with the disease. The number one cause of not doing well with lupus, such as having more severe disease and higher death rates, is non-compliance. If someone does not have the means to be able to afford the best medical care and is not able to take the medications required to manage lupus, it automatically makes them non-compliant against their will. This places them at a high risk of not doing well. In addition, although some people who have lupus do manageably well, live long, near normal lives, and are able to work with minimal or no problems, some people are not able to continue working. I'll now look at a few ways that warriors can maneuver unaffordable medical care of lupus. So one of them would be going to government-funded clinics and hospitals, such as Kenyatta National Hospital here in Kenya. Another one would be to strive to obtain an NHIF card and ensure it remains active. It will cover some costs, albeit minimal at the moment. Lobbying and making strides to have lupus medical care accommodated in the NHIF cover will go a very long way in supporting lupus patients to afford medical care of the disease. This lobbying has unfortunately not made many meaningful, significant progress so far in Kenya. A third one would be going to medical drives for free services. These are sometimes offered at subsidized rates or free. Though this may not include the specific regular tests done for lupus to check disease activity, one may still benefit by knowing their position as far as other ailments is concerned, such as blood pressure, eye checkup, dental checkup, and the like. The fourth one would be avoiding duplicate tests. For most lupus patients, you will find that we also have other overlapping conditions. So the whole idea is to take matters into your own hands. So keep copies of all your tests results. It is common to have a repeat lab test because doctors do not have the results of each of the tests that they require for your regular reviews. A good way around this is to take things into your own hands. Every time you get a test done, ensure you have copies of the results for your personal file and for all the doctors who are managing you. For my case, I see both a rheumatologist and a cardiologist. So regardless of which doctor has sent me for lab tests, I always ensure that my files at both doctors' clinics have a record of the results, which I keep, and I also keep a copy for my file. I carry this file at all my doctor's appointments. I also try to synchronize reviews with both doctors. That way, I do not have to repeat some of the tests for purposes of either doctors. A fifth option would be to look for bargains on medical equipment. Find good deals on medical equipment such as crutches, wheelchairs, walkers, compression socks, knee braces, and so on. Sixth would be to learn to budget. When you're strapped for money, it is even more important than ever to learn to keep a budget and stay on it. Before buying anything, just ask yourself, is this something I really need or something that I want? Be honest. If it's the latter, just keep it. Seventh one is eat healthy and cheaply. This has been mentioned by several doctors who have spoken earlier, and even some of the warriors who've spoken earlier. So we cannot overemphasize the need to eat healthy. Eighth would be exercise. Exercise can be free. Brisk walking or walking on the spot at home on a regular basis, say 3 times a week. The idea is not to lead a sedentary life. The second last one is to learn to treat some conditions on your own without using medication. For instance, insomnia or fatigue. Many people can control many of these problems like insomnia or fatigue adequately by simply eating properly or exercising adequately or getting rid of bad lifestyle habits. Even if you're not able to get rid of your problems by doing some of these suggestions, often you can decrease the severity enough so that less expensive medication can be used to help you. And then finally is to get generic medication as opposed to the originals, which also work just fine. Consult your doctors on this to enable you manage the cost of medicine. So in conclusion, I have this message for the warriors. Keep reminding yourself that bad days will not last forever. If today does not go as planned, there's always tomorrow. I do not have to be perfect to be worthy. Today might feel overwhelming, but I can make it through. Promise yourself to stand and feel your worth beyond the grips of lupus. Thank you.
Wow, Veronica, thank you very much. Excellent presentation, excellent pointers on how to navigate finances in the midst of lupus. Thank you very much. One of the key pointers for me that I got were that one actually needs to look at the costs that they're going through, see how to actually mitigate and lower the cost, especially this about generic drugs, looking around, sharing tests between various doctors that one sees. And the other bits, the other doctors are talking about, the other warriors talked about how to create a work-life balance, more relaxation, so that you can now help you to generate more money. Thank you very much, Veronica, for the excellent talk. We have now come to the end of the talks, and I appreciate all the presenters for taking your time and making the presentation. What we'll now do, we'll go into, because we have exceeded our time by 14 minutes, maybe just use 10 minutes for those people who are still around, do a question on, to answer the questions that were shared in the group. I have not seen any question for the warriors, but I will ask, let's say like Veronica, there are no questions for the warriors, so nobody, but people have appreciated your courage and your presence and your presentation. There are questions that are picked so that's in the interest of the 10 minutes. And the first question will, I request Dr. Owino to answer. It's a question on neonatal lupus. Dr. Owino, would you like to make a comment on neonatal lupus?
Thank you, Paul. I've not seen the question itself. What does it say?
Just says, make a comment on neonatal lupus. They don't,
okay, so we said that women who have lupus or who have some what we call antibodies, certain antibodies, sometimes they may not even have lupus symptoms, but they have those antibodies, may give birth to children who have what we refer to as neonatal lupus. So these children usually present with skin rashes, and they may have maybe fever, but this is usually transient. In other words, it clears off after a few weeks and leaves no problem. However, there is one complication of that neonatal lupus that we have to be aware of and that we have to look out for in all the women who have lupus who get a baby. And that is what we call heart block. In other words, the heart is not able to beat at the correct rate. Usually the heart is very slow. And these children, if they are not treated, they will die. So, because the heart cannot beat at the normal rate that is required for blood to circulate in the body. So usually we need to evaluate those. Ideally, in fact, this should be found even before the woman gives birth. When the baby is still in the uterus, we can do the ultrasound and other tests that can actually show whether the heart is beating correctly or not. If it is confirmed that that child has heart block, there is treatment for this where you put something called, a maker that helps the heart to beat properly. And this is treatment that is available even at the Kenyatta National Hospital for those who are in Kenya and in many of the other major hospitals. So basically neonatal lupus is the lupus symptoms, mainly on the skin, but that is usually transient or wears away in a few weeks. But there is this other serious complication that we have to look out for in all the women who have lupus, actually right from the time the baby is still in the uterus before the baby is born, and then immediately after birth. And if we find that the child has this thing we are calling heart block, where the heart is beating very slowly or very, very irregularly, then the child has to be assessed, and immediately after birth, plans made to put this one we're calling pacemaker, so that the heart can beat normally. Thank you very much.
Thank you very much, Dr. Owino. Dr. Eugene Genga, there's a question for you. Somebody asked about restricted diet for lupus. Any comment on this? And then after that, should one use honey rather than sugar?
Thanks for the question. I didn't get the first diet. Was what again? Sorry.
I think they wanted just a clarification on the restricted diets for lupus. What diets are restricted? And the second question, should they use honey rather than sugar?
Okay. In terms of honey or sugar, not much difference. I think it's just limiting the amount of calories you take. So maybe honey is usually the safer form of the sugar. In terms of the restricted diet, to be honest, there's really not much. In fact, there's not much you can say that is a typical lupus diet. What they just advocate is more of having a balanced diet, making sure you have enough carbs, enough proteins, enough vitamins and all that. And we tend to avoid more of the saturated fats, processed foods. That has been shown to help, because some of like the disease, the drugs can cause you to have the disease can cause you to have a lot of heart issues, pressure issues, and all that. So we tend to avoid more of the processed foods and all that. So there's not really much on anything per se like a restricted diet. Thank you.
Thank you very much, Dr. Genga. Eugene Genga. Professor Yo, a few questions for you. One of the questions is, what is the safest biologic? That's the first question. The second question is, what medication in lupus causes an increase in appetite? And the third one has nothing to do with medication, but it's just a comment on CNS lupus, and then lupus and bipolar disorder. Thank you, Prof.
Thank you very much for those questions. The first one is, what is the safest biologic in lupus? We don't have very many biologics to be used in lupus. The one we are using is belimumab and rituximab. The others are just coming in. But generally, in comparison with the other drugs that are used in lupus, the biologics have got generally a better safety profile. A few can predispose you to infections, and that's one of the reasons why you want lupus patients to have vaccines, to have vaccines for pneumonia and influenza. But generally, they have a fairly good safety profile. The drug, what causes appetite increased appetite in lupus? The drug that causes increased appetite is actually prednisone. And judicious, and it is also associated with high mortality because of its cardiovascular effects. And one of the advances in management of lupus, which have improved patient survival, is the judicious use of steroids. And one of the judicious use of steroids is associated with the high mortality, because once you get a lot of appetite, you gain weight, and you will get high blood pressure, you get diabetes and all that. And then you know what that leads to. CNS lupus, lupus is central nervous system is always affected in lupus, and we consider it one of the emergencies, severe emergencies in lupus, which has to be treated very, very aggressively. When you see us in children are treated aggressively regardless, but when you see us engaging another gear is CNS lupus and renal lupus, vasculitis. So it can affect any central nervous system problem, can be there, ranging from headache. Headache is a headache in lupus. Almost everybody has a headache. Then you have stroke. You have various forms of nerve problems, and they usually attract a lot of aggressive management. What about lupus and bipolar? Mention any psychiatric problem, it can occur in lupus. Even bipolar disorder, just depression, to the worst form of psychiatric illness, schizophrenia, and all that. So many of the patients are found in the psychiatric unit. They are admitted as psychiatric patients when they develop fever or loss of hair. Then people say, oh, this patient, call a physician. Then in the process, you find this patient has got lupus. So psychiatric problems are a very close cousin of lupus, and many patients with lupus have got psychiatric disorders, and usually you manage them together with psychiatrics. And bipolar is just one of the various psychiatric manifestations that you can get in lupus. I hope I've been able to handle the questions that were put to me.
Very well handled, Prof. Thank you very much. Very well handled. The other question is now to Dr. Okewa, who is a medical officer, but is a lupus champion and has been assisting the warriors. Dr. Okewa, the question is to you. Why is lupus common, more frequent in females? Dr. Okewa? Okay, we are not able to get him. So I'll now pass this question to Dr. Nakitare, who will answer why lupus is common in females, but at the same time, answer a question on just somebody wanted a recap on fertility and lupus and what are the risk factors for subfertility. And then if you can also make a comment on pleural effusion and lupus. But I've noticed that Dr. Okewa is on. He can answer on the why lupus is commoner in females. And then Dr. Nakitare will answer about the subfertility and lupus and the risk factors and the pleural effusion and lupus. And then after that, we'll have come to the end of the question and answer session. So, Doctor. Dr. Okeo? Okay, so Dr. Naktari, please proceed.
Hello, thank you.
Okay.
Okay, so probably I might answer them in reverse. So I'll start with the question about the pleural effusion. So I'm assuming it was just a comment, there was nothing specific about it. So I'll make a general comment. So pleural effusion is one of the possible ways in which lupus can manifest. It can manifest together with fluid. It is a fluid accumulation in the lungs, and it can manifest together with other fluid manifestations in the lung and other symptoms which suggest that the lupus disease is active. So one needs to, first of all, when approaching a pleural effusion in the setting of lupus, is to first of all start with a broadening before narrowing down and blaming the lupus for the effusion. It is important to rule out the various differential diagnoses of this effusion, key amongst them being TB, which is common in our setup, but the other possible causes, parapneumonic and other things that may occur. So for the healthcare professionals, it is about investigating that effusion adequately and considering whether there are other symptoms suggestive of active lupus before deciding that this is purely lupus and I'm going to treat it as part of the treatment of the lupus. That's what I have to say about that. Issues about fertility. So for fertility, first thing first is to think about anything that can affect the general population can also affect people with lupus. So issues that surround fertility that include age, aging or the age at which the patient wishes to have these children, other things that may occur both in the female and the male, including for the females if the tubes have been affected by previous infections or other factors. For the males, issues about the sperm count, whether it is low for various reasons or the other, and also about the actual relationship and the actual way in which the patients are trying to have children. But now for lupus itself, it is said that their fertility really compares well with the general population, i.e. it is not necessarily lower than the general population, but when you bring in factors such as the medications that are being used, the disease activity, and other factors, those may now go ahead to reduce the fertility, in some ways make it seem as though it is lower than the general population. So medications like corticosteroids, which may affect the hormones associated with sexual function, which may have drugs like cyclophosphamide that may cause hypogonadism. All those drugs can affect, medications can affect fertility, and then amongst other things. So that is what I would comment about fertility. And the key thing is to, as you manage the lupus, work with a gynecologist so that you can investigate the general population issues and then look at what are the options that the patient has to manage or solve that problem. And then finally, about why lupus is more common amongst females. In general, rheumatologic diseases are more common amongst female, and there are various theories, but I don't think anyone has actually managed to put the exact finger on what that reason may be, because even if it's more common in females, there are still males who get affected by these diseases. Just as in a simplistic way of putting it, it may have to do with hormonal issues, biological issues that are unique to females. There are all these thoughts about how the triggers or behind the pathogenesis of this condition, hormones may play a role, not only in lupus, but in the other rheumatologic diseases. But that is just a simplistic way, perhaps because of some genetic and hormonal factors, these diseases appear to affect females. I hope that that is adequate, Dr. Tao.
Thank you very much, Dr. Very well answered. For your final question, this is a final question for you. It's actually written directly to Prof. The question is, can one have lupus if only anti-nuclear antibody test is positive and all the other rheumatological tests are negative? So can one have lupus if only NA is positive and all the other rheumatological tests are negative? Yeah, Prof.
Thank you. The answer is yes, but it depends on what else you have. You know, lupus, or indeed most of these connective tissue diseases, you try to piece several things together, as was well illustrated by one of the warriors. I think it was Nagicho. Making a diagnosis of lupus is very difficult initially, and the person who sees you 1 year later or 2 years later may look wiser than the one who saw you the first time. But lupus is not just anti-nuclear antibody. Anti-nuclear antibody can mean nothing in 30% of the general population if there's nothing else. So you must have, we have a scoring system. We have criteria, various, looking at the various systems, the central nervous system, the blood system, the skin, the kidney, and the various other antibodies. So if you have anti-nuclear antibody positive with other like arthritis and kidney problem, or maybe anemia, that qualifies you for lupus, even if the other tests themselves are negative. So the answer is yes. And if you are just looking at anti-nuclear antibody alone positive, with nothing else, with no other symptoms, then you don't have, you cannot make a diagnosis of lupus based on anti-nuclear antibody alone. But yes, so the answer is yes and no. It depends on what else the patient is having at that point in time. Thank you.
Thank you very much, Prof.
The other thing is that the patient may not have something at that point, but may develop it as time evolves. You know, as time evolves, the patient may develop. You can start with anti-nuclear antibody positive arthritis. Then after 1 year later is when you start having losing your hair. Then you start getting skin problem and so forth. And somebody might forget the previous things. So all those records must be kept to make a diagnosis. Thank you.
Thank you very much, Prof. Very well answered. Thank you very much. Mine is to thank you again on the behalf of Kenyatta National Hospital, of my own behalf as one of you, to thank all the warriors, to thank all the presenters, to thank all the participants, to thank everybody who has made this World Lupus Day event successful. We're to get a vote of thanks from Dr. Okewa, CEO, but he seems not to be able to come on to the mic. Dr. Okewa, are you on?
Yes, I'm on.
Okay, so now it's your time for you to wrap up this day, make any comment, and then close the meeting for us.
Okay, thank you very much. As Dr. Tewa has mentioned, I'm Dr. Siomo and a champion for patients with lupus. So because time has so much spent, I just want to thank all the speakers from our consultants and the warriors who have shared. Just to mention 3 things very fast. We have 2 groups so far that champion for lupus, Federation of Africa, and SCLAD, that is scleroderma, lupus, and other autoimmune diseases. So in these groups, some of the problems we find is finances. You find that patients, sometimes we have to actually solicit for funds for patients to see consultants, to seek medications. Actually, we lose patients sometimes. Like this year, we have lost 2 patients, and you realize that one of the reasons is finances, that they can't afford medications. Lastly, I want to request the fathers of the profession, like of Professor Yo, Dr. Itau, to find ways of including lupus ability in the country. Otherwise, thank you very much, and may God bless all of us.
Thank you very much. Thank you very much. Now, thank you all. Now we may leave at our pleasure, and hopefully see you in the course of the year, and we try and make another World Lupus Day event successful next year. And hopefully we achieve great strides in the coming year to improve the outcomes of our patients with lupus. Thank you, warriors. Thank you, Professor Yo. Thanks, Dr. Nakitare. Thanks, Dr. Genga, for the work that you do in care for the patients. Asanteni sana, and of course the training and the teaching and the research. Thank you, warriors, and have a good night. Asanteni sana. And thank you very much, Nelson from the Research Department of Kenyatta. Thank you to the CEO, the management of KNH for giving us this platform and for making this a successful day. Kwaherini nyote, and have a good night.